Let's go to the front lines of World War C, World War coronavirus. Joining us is Mike Butler, President, Operations and Strategy at Providence. Boy, this will be interesting. Mike, welcome to the Mark Mason Show.
Oh, great to be with you, Mark, and really appreciate you having me and have an opportunity to hear from Providence.
And Mike, you've been with Providence for 22 years, so I guess you can say you've seen it all until now.
Exactly. Yeah, we've been through a lot over the years with, different recessions, different changes in Medicare, but nothing quite like this that combines, a public health challenge with an economic challenge at the same time.
Yeah, well, you got three districts, three areas, Oregon, Washington, California, particularly hard hit. Texas to a degree, Montana, Alaska, New Mexico. How has COVID impacted the communities you guys serve?
Yeah, well, number one, about a month ago, we put in place a incident command center to really begin to understand what this would mean to each of our communities and how we would respond. And so we have been well on our way of, making sure that if the surge hits the degree that we've heard, that we are well prepared for that. And I think, as everybody knows, the first case was January 20th in Everett, Washington. And so we truly were kind of at the front end or at the epicenter of this. And so we have things that we're doing system-wide as an organization in terms of, dashboards tracking the number of patients that we have and the number of patients that are possible COVID patients, being able to track what our supply chain needs are, what our people needs are, what our bed needs are, what our ventilators needs are. And so I think the great thing about being part of an organization like Providence, the scale that we bring, is that we really can build good systems and structures to support our communities as they go through these challenges. Obviously, the biggest challenge in terms of the most patients that we're seeing are in the Washington state market, particularly in the Puget Sound. We are beginning to see a little bit of leveling off in terms of new patients tested positive, but that may be the lull before the storm. We're far from bullish about the trend is headed the positive direction. But again, keeping really close track and preparing for the worst case scenario.
I don't want to turn this into a gripe session, but are we in need of more test kits? Are you guys behind the eight ball with test kits?
Yeah, we are behind the eight ball in test kits. Things are improving. We're behind the eight ball as it relates to what we call PPE, which is the
Yes.
supplies that we use to protect our patients and whatnot. Although I would say we're making progress on all fronts. A lot of the fronts are grassroots opportunities. Example, working with COS, which is a furniture maker here in Puget Sound, and Nordstrom's are actually building our own masks and whatnot to be able to deal with the challenge. But yeah, it's interesting. If you look at South Korea, their first case was on January 20th, just like ours was. And they immediately went to the social distancing, and ramped up testing to test over 250,000 people. And I think it gave them a better road forward than we have here in the United States. But, we continue to see more tests pop up each day and are able to give those particularly to our caregivers on the front line because they're the ones taking care of these patients, as well as all the other patients in our hospitals that are not COVID related.
Mike, on behalf of my listeners, would you mind letting the frontline people, the nurses, the doctors, everybody who's in the labs, let them know how appreciative we are that they are keeping some sense of normalcy as best they can in the wake of this tsunami that appears to be headed our way. But a big thank you from everybody here in Oregon and Southwest Washington for what they do and for everybody through Providence. What else can people do besides a thank you? Is there anything else we can do on our end to make their job better?
Yeah, number one would be, like I said, at the front end, stay home because reducing the spread is the single most important thing we can do. Number two, take actions, meaning there are a lot of places that you can donate with regard to COVID, whether it be donating, cash. As an example, we put $500,000 out there to really focus on equipment research, resources, and patient care that we need going forward. Number two, there's this mask challenge. So we challenged kind of the country to come up with 100 million new masks. And there's all kinds of ways to be able to participate in that. And then letter writing. It's really important that we continue to send to Congress and others the fact that we truly do need federal funding at the front line for our hospitals, health systems, doctors, and nurses as well, in anticipation that this could get a lot worse. So that would be the things that I would, ask for people to do. And to your point, thank caregivers, pray for caregivers and whatnot. One of the interesting challenges for caregivers, 23% of our caregivers have kids that are in school, and now those kids are at home. And so helping them balance out, either child care or somebody at home to help support them during this time is really important. So yeah, they have, I think, the most stressful jobs that anybody has right now in our country in dealing with this.
Well, Mike, I'm sold on Providence. I'm all in, so I'm already a Providence guy. Let me ask you this. Thinking through the crisis now, let's hope it ends sooner rather than later. What are some of the good things that could happen from this crisis? And I'm thinking in my mind, telehealth, this mobile health where you can do over a smartphone or a home computer. What are the things we can look forward to that will be better because of this crisis? I'm thinking there's got to be a positive.
Yeah, it's a really great point. One of the interesting things we began a few years ago in Providence, and that was we said, let's step back and deconstruct the health system and really understand as we look to the future, look to technology, how do we assure that we organize our physician enterprise appropriately? How do we ensure that our communities have the right ambulatory care networks, meaning express cares, urgent cares, ambulatory surgery centers in the right place? And also, how do we provide the best home and community care? Meaning, how do we do, home infusion? How do we do home care? How do we do hospice care? And I got to tell you, it may be one of the biggest blessings that we've had out of this. So just to give you an example, we have like 42 express care sites throughout the communities we serve, and these are for people that come in and out quickly. We made a decision that probably the smartest thing we could do would be to actually close those particular retail sites, but take all the physician assistants and the MAs, medical assistants, and have them participate in telehealth. And just to give you a sense, we did the same thing actually. We stood it up today. So we have 8,000 physicians who are now available for telehealth visits or virtual visits. And the thing is when we began down this road of creating this virtual visit or telehealth as an organization, we were really, I would say, frustrated with the fact that consumer adoption was going really, really slow. And what we're seeing now, given this crisis, the consumer adoption of virtual visits, telehealth, has just ramped up dramatically. In fact, it's ramping up almost as fast as we're seeing visits to our emergency rooms go down. So we are really hopeful that that the use of technology going forward will be an absolute imperative. I mean, absolute conviction of people to use it. And what's really neat about it, we were talking about a little bit earlier this morning, is there are a lot of people at home that are going to start dealing with symptoms of depression, et cetera, whatnot. And so they'll have access to their physician, all 8,000 of those, virtually, so that if they're they can have interaction with their doc if they're not feeling well, if they have chronic diseases and whatnot. So I think that is going to prove to really be the most significant transformational change that will happen in the industry going forward, that will better serve everybody in our communities and much more affordably, quite honestly.
Indeed.
As well.
It won't be long. Let's just cross our fingers that it won't be long until we get there. Mike Butler, President, Operations and Strategy at Providence. We appreciate you being on the Mark Mason Show today, and I hope we can call on you again.
Absolutely. Thank you, and thank you for all you do.